warahmatullahi wabarakatuh. Hello everyone, hope all's doing well. I'll be covering a retrospective study with a primary outcome to measure the success rate of orthograde retreatment after failed episectomy by the German endodontics researchers Dr. David Appel and Edgar Schaefer. This paper was published in the International Endodontics Journal in April 2023. The available literature shows different success rates for apical surgery ranging from 37 to 85% as reported by Friedman and Moore in 2004, and are even higher in cases that were subjected to orthograde retreatment before performing the episectomy. However, for insufficient root canal fillings with a root canal system that is harboring a high remaining bacterial load, even a state-of-art apical surgery using the most recent microsurgical methods has lower success rates as reported by Von Arx in 2010. The surgical attempts to leave the remaining microorganisms and just simply prevent the communication with the periapical tissue may fail because of the leaky retrograde fillings, insufficient coronal restorations, and incompletely prepared areas in coats isthmuses, and it could be assumed that the remaining microorganisms is the cause for the persistent apical periodontitis. And due to the high success rate of orthograde retreatment with the aid of microscope and complete preparation of the entire root canal system using effective disinfection and irrigation and sufficient obturation of all the canals, in June 2008 suggested that high success rates can also be expected in orthograde retreatment after failed or unsuccessful episectomy. The currently available literature provides merely 3 studies with comparable aim: the Turkish study by Kaska in 2005, Mente in 2015, and Holzman in 2018. These studies' findings varied considerably, with success rates ranging from 45.5 to 82.6% of success rate after performing orthograde retreatment of failed episectomies. However, this retrospective study was carried out in a non-education institution and was conducted in a private dental practice limited to endodontics in Germany with at least 3 years of professional experience endodontists. For the inclusion-exclusion process, they included root canal-filled teeth with episectomies, teeth that had no reduction or enlargement of an existing periapical lesion at least 2 years after the episectomy or having distinct clinical symptoms, and only involved patients who attempted the follow-up appointment after a minimum of 12 months up to 12.5 years, and they excluded teeth with longitudinal root fractures, teeth that were involved in dental trauma with mobility or pre-existing perforations, and the cases with unavailable adequate radiographs, and excluded any patients with any kind of systematic disorders or taking any kind of systematic medication. So a total of 191 teeth were included. They removed the previous root canal fillings with rotary and edge files, and they also attempt to remove the pre-existing retrograde fillings from the orthograde with ultrasonic tips and micro openers. However, few unsuccessful removal of the retrograde fillings cases of 33 were left in place, and they placed calcium hydroxide dressing as an intracanal medicament. And after 7 days in the following appointment, the dressing was removed and an apical plug using ProRoot MTA from Dentsply Sirona of 4 mm length was placed, and all canals were then obturated using injectable warm gutta-percha with AH plus sealer, and the access cavity were sealed using an adhesive resin restoration. The intraoral PA radiographs were taken immediately after and regularly at the recall intervals, which were standardized at a minimum of 12 months and 24 months, and the overall recall rate was 54%. Success and failure were evaluated radiographically by 2 observers according to the criteria described by Molvin and Rudd in 1972, who categorized the treatment results into 4 groups: Group 1, complete healing; Group 2, incomplete healing or scar tissue formation; Group 3, uncertain healing; and 4, unsatisfactory healing. Groups 1 and 2 were considered as success, and Group 3 and 4 as failure. They also wanted to evaluate the effect of prognostic factors and predictors such as gender, age, location of the tooth, and the pre-existing retrograde filling that left in place on the treatment outcome. The hazard ratios of the predictors were analyzed. However, none of these predictors had an influence on the treatment outcome. The results of this study revealed that the overall percentage of success rates was 84.82%, with a complete healing of 79% and incomplete healing of 5.7%. This is a representative example of score 1. As you can see on the left, the diagnostic radiograph of a mandibular first molar, and on the right is the RICO radiograph after 13 months showing complete healing. Another example of score 3 on the left is the diagnostic radiograph of the maxillary lateral incisor, and on the right is a recall after 12 months, also showing healing. The Kaplan-Meier survival analysis showed that the cumulative survival after 13 years was 43.7%, with mean survival of 8 years. Therefore, it seems reasonable to assume that even in cases of failed episectomies, the main treatment approach should aim at improving the quality of the root canal treatment instead of merely performing resurgery. And periodical resurgery will be of very limited benefit in cases of inadequate preparation, disinfection, and obturation, as the remaining bacterial load inside the canals causing the persistent apical periodontitis cannot be adequately addressed surgically. And even though the modern endodontics microsurgery achieves high success rates, but the less invasive treatment, which is the orthograde retreatment, should be considered first. One major limitation of this study was, and the most relevant one, was the low recall rate of 54%. However, a great portion of the intended follow-up examinations fell in the period of COVID-19 pandemic, which resulted in missing out on their recall appointments, but these patients were called by the phone and reported that they were free of any pain and the treated tooth was functional and in situ, and that they therefore refrained from attending the follow-up examination. Thus, although the recall rate was lower than preferable, based on the telephone inquiry, it is reasonable to assume that the reported success rates represent the lower limit of the actual treatment outcome. And thank you so much for listening. Hope you have a good day. Bye-bye.